Good morning, everyone. My name is Peter NYDIS, and I'm the Executive Director of New York Disaster Interfaith Services. I'm also joined by my colleague, Dr. Lucy Cummings, who's the Senior Manager of our Faith Sector Community Preparedness Program. I also want to thank all of you for showing up today and joining us for this training on crisis and emergency risk communication, which is more commonly called CERC. It's probably most easily understood as simply emergency communications for congregations and faith-based organizations in the context of this training, of course. So I'm going to briefly talk about this topic and this use of the acronym CERC. So CERC is really government parlance, a government term for communicating in times of emergencies. So both crises and emergencies, and risk communication implies how we communicate the risk related to that crisis or that emergency. So this course really is about the principles of how we communicate, what is important, what order, and how we use our information, whether or not some of that information should be kept confidential, shared publicly, and the order in which it's shared. My computers, there we go. Okay, so we want to talk about how the faith sector communicates, but in the context of how we communicate differently than secular organizations or government. So what's the purpose of our communication? And recognizing even within faith-based organizations, there's different populations that we're trying to communicate with. We could be communicating internally with staff. We could be communicating internally with members of a worshiping community. We could be communicating internally with clients. We could be communicating externally with the neighborhood, if you will, the community around us. And we can also be communicating broadly on things like social media that anybody can read. The terminology and purpose of CERC is not something I want us to get distracted by, because as I said, CERC is really a kind of a government acronym. That being said, in any kind of a crisis or emergency, we often end up communicating with first responders and with the government, and sometimes, depending on the scale of the event, with the press. So communicating effectively and accurately and appropriately becomes a matter of credibility and trust. Because if we don't have credibility and our messaging isn't trusted, no one is going to take our messaging seriously and potentially put themselves in harm's way if they don't hear that information and understand that information. It's also important that we understand the components of risk communication. So what should be included and what should not be included, and what order that information comes out. And the worksheet, as you saw, is helpful in terms of composing a message. A few pointers, if you will, in how to compose a message. Raphael mentioned that he's coming out of a law enforcement background, and he and Eli and others are sometimes coming from the perspective of security versus pastoral communication. So some communication is about public safety, and some communication is expressing pastoral concern and resources to those in crisis for emotional and spiritual support. So that purposefulness of that communication also depends on what our role is within the institutions that we serve. So I want to briefly talk about why we're talking about this topic. So NYDIS is the convener of the New York City Faith Sector Community Preparedness Program, which is funded by New York City government. So we are an agency that takes a lead agency function, which is a more government emergency management speak, for addressing the resilience of the faith sector in New York City. So we offer trainings, we offer free resources, we have a risk communication plan in collaboration with the government. We also have lead agency function for disaster spiritual care. So NYDIS and the American Red Cross are the two lead agencies for disaster spiritual care, crisis spiritual care, disaster chaplaincy. It's called different things in New York City. We also convene a variety of other mechanisms like long-term recovery groups and unmet needs assistance and that sort of thing. So just like us, you have different programs, if you will, different constituencies within your institutions. And who needs to be a part of communication is a matter of what you're communicating about. Obviously, a communication from a security officer that is about, for instance, a rabbi's pastoral remarks about the death of a member of the congregation doesn't feel like the right person to be communicating. But if the situation is a security situation, then the security lead would be the one communicating about a safety matter. So who speaks matters as much as what we're speaking about. And again, making sure the information is accurate, it is trustworthy, and the messenger is trustworthy.
Peter, we have two more folks who've joined us. I'm wondering if they can introduce themselves.
Yeah, I don't want to break up the PowerPoint presentation that way, because then we have to do too much editing. We'll do that in a break.
Okay.
So the faith sector framework for New York City is about how we adapt emergency information shared by government, and government can be emergency management, government can be elected officials, government can be the federal government, the state government, the city government. Lots of people are communicating information in an emergency. The question is, does that information being shared does that information being shared make sense in a religious context? Is it being shared in a way that a community of faith will understand it? Does that mean it needs to be translated into a different language than it's commonly being shared? Does it mean that it needs to be given a context for how houses of worship gather? For instance, there was lots of information shared from public health officials throughout the pandemic about public safety, but it was often very generic, and it didn't necessarily translate to how houses of worship pray together or worship together or take communion together if they were Christian, or physical touch between individuals like handshakes or ritual kissing and the kinds of things that go within a congregational context. So sometimes the information that's being shared doesn't directly translate, and we have to do some translation, but we have to make sure our translation is accurate. Using culturally and religiously competent language matters as well. First of all, people are expecting that from a faith-based organization, but we're also adapting information in unique ways. So I'll give an example. The outbreak, well, several years ago now, of Ebola that resulted in some people arriving in the United States that had been exposed, really created a lot of public fear. And there was misinformation being shared about Ebola and how you get it, as much as there was misinformation or disinformation about COVID. The Ebola outbreak, interestingly enough, the news broke out on a Wednesday here in the city. But by the time Thursday rolled around, there was an enormous amount of misinformation going around. And New York City decided to have a briefing for New York City religious leaders on Friday evening. The challenge with having any kind of an emergency forum on Friday evening was that we had entered into the Sabbath window for the Jewish community, for the Adventist community, for other faith traditions who now weren't going to be able to get on Zooms or conference calls, and therefore weren't necessarily going to be getting information. But Ebola was spreading quickly, so every 24 hours counted in terms of accurate information. Nevertheless, the city had to prepare not just to communicate on Friday, but to communicate again on Saturday after sundown, because we were going to miss hundreds of thousands of New Yorkers who were observing the religious Sabbath. Their initial assumption was, well, this is an emergency and everybody will listen anyway. That is a false assumption. When it comes to religious practice, it is a false assumption that people will somehow disregard religious obligation to meet the government's expectation of when and how and where communications about risk will be shared. So here in NYDIS has these types of tools for sharing risk communication. We manage the New York City House of Worship alert system. So this is a text robocall email platform that can send messages to New York City religious leaders. And when I say religious leaders, I mean both lay and ordained leaders in faith communities that are in a leadership position. We have a email platform called NYDIS Net Alerts. This is an email only platform, unlike How Alert. We post frequently on social media, and we also have an emergency alert function on our website. So a flashing beacon when there is an emergency and emergency information is being shared. There are also public information risk communication platforms. For instance, Notify NYC is one of the alert systems here in New York. New York State also has a New York State alert system that you sign up for by your county. And some towns have their own alert systems as well. It's more and more common. Most of these are text systems, and the reason government uses text systems is because it takes far less bandwidth to send a text message than it does to send a voice message or an email. So it's the fastest way to communicate, and it's much more likely to be received than email or a robocall, for instance. That being said, there certainly are robocall capacities to many of these systems as well. Usually they're used for hurricane warnings, evacuation warnings, flood alert warnings, bad water problems that happen in the state sometimes when sewage containment overflows and contaminates water. Those are probably the more common uses. They're also used for public health messaging, sometimes when there's outbreaks of E. coli from a restaurant chain, one of the more common public health emergencies, or things like meningitis, clusters in a school system, fairly typical to receive those messages. There's also more formal networks for emergency communication that some congregations can have access to. NYDIS, for instance, is part of something called NYPD Shield. So this is a counterterrorism communication tool that New York City Counterterrorism produces on a regular basis. And if you request to be part of NYPD Shield, you will receive these risk assessments, threat assessment documents. Now, let's be clear, these are not top secret kinds of communications. This is, however, it's information that's not necessarily shared with the public. So it is risk assessment, but it is not any kind of national security level risk. There might be references in there, but those kind of details are left really to higher levels of enforcement. Please mute yourself if you are. There we go. There are other communication organizations, sometimes within faith communities. So the Jewish community, for instance, uses something called the Secure Community Network, so that shares its own intelligence, often around the vulnerabilities of the Jewish community to anti-Semitic attacks or vandalism, other kinds of security and threats against the Jewish community. So there are many opportunities to monitor risk and to share risk communication. But as I was referencing, it is critical to understand who needs to receive the information and when, and who doesn't need the information or shouldn't get the information. As a point of reference, children should not be privy to scary information. And when I say children, I don't mean anybody under the age of 18. I typically mean children who are elementary school age and under. Children that can't process and understand fear and threats the way a more mature adult mind can. It can be traumatizing to them and very disruptive to their sleep and ability to focus. This kind of information can have that effect on anyone, but it's more likely to have that effect on children and those that have cognitive disorders. So people with potentially things like Alzheimer's and dementia, they're not going to process that kind of information in a way that's constructive and that they can kind of back down from once they've heard the information. It's just overly terrifying to them. And they obsess and and out of concern for others that they perceive they might be responsible for. Excuse me. I want to give an example of how communication can also cause a great deal of stress and strain on families. The Sandy Hook school shooting that took place several years ago in Connecticut, which was a profoundly mentally ill young man who went into a public school, elementary school, and murdered a couple dozen people, mostly children, but also some educators. It wasn't particularly long after the shooting that law enforcement knew which children had survived and which children were likely to be dead. However, all the parents were asked to go to the town firehouse and await news there. The problem is that the families of the dead children weren't told that their children were dead for several hours after law enforcement knew who was dead. And it was something that the parents really were very upset about. There wasn't a reason not to tell them that their children were dead, except for the fact that they were trying to go through a more sophisticated level of body identification than was probably necessary in such a small town. But it was enormously damaging to the parents and their trust of public officials around communication related to the shooting. They always suspected after that that information was being withheld from them. So it can compromise trust when we are overly obsessive of accuracy and not as concerned pastorally about what people need to know and when. But obviously this is a negotiation between both law enforcement and the pastor, if you will, or the caregivers overlooking a community that's been affected by a trauma. So let me talk about how the House of Worship Alert system works. And I also want to say that this kind of technology is available to congregations for its own internal communication. The question is, how do you use it? So as I mentioned, the New York City House of Worship Alert System is a technology tool that we manage in partnership with the city. It's free. It is specifically targeted towards clergy and senior decision-making leaders within congregations. It's really not for the public because it's sharing information that they should share. And how they choose to share it is a matter of them knowing how their congregation or their clients or their staff should receive information and who they should get it from. As I mentioned, it comes in emails, text messages, and voicemail, and it uses a kind of technology that tiers the information. So we first send a text message. If the text message isn't received, the system knows it and it sends an email message. And if the email and the text aren't answered, it will call, it will make a robocall. So it's a smart system that tiers the information to make sure that it's getting to its intended target. You can turn off that function, but we would not turn it off in an emergency because it's more important that people are bugged and they get the information than it is to not upset people or not bug them, if you will. But the challenge with all these kinds of communication tools, risk communication tools, if we use them too much or the wrong way, people don't listen to them and don't trust them. So you could use this kind of communication as your dentist does to remind you that you have an appointment or that you need a prescription refill like CVS does. And you expect that from CVS and you expect that from your doctor. If a church uses its emergency communication text capability to start advertising about which pastor is preaching today and the fact that there's going to be a potluck supper and that there's a fundraising reminder, when it comes time for an emergency communication on that same platform, they are far less likely to listen to the message because they'll just think it's annoying routine communication. So when you do use a technology platform for communicating risk, it is important to not use it for anything else but communicating risk. Or at the very least, preface those communications that are emergency communications and those communications that are routine, so people know which one to pay attention to. But again, it's not recommended to use the same platform. This kind of technology also allows two-way communication. So within our system and within other platforms, you can send, for instance, callback numbers or survey questions or hot links to form sets. So you could send a form to every member of your congregation that said, you were at a potluck this afternoon. We've discovered that some people got food poisoning. Please press 1 or text us back 1 if you're having symptoms of food poisoning, and 2 if you don't have any symptoms. So that information gathering is usually called reverse 911. So it means you can send emergency information and you can get emergency information back. It polls, so the question about, answer 1, 2, or 3, whatever, that's called polling. And it can also have, as I said, a link in it where you could fill out a form with more information than you would be able to answer through just answering a question with numeric answers. These platforms, this kind of text communication is available to smaller institutions. It is not inexpensive, by the way. We pay several $1,000s a year for a license for this system, but there are much more affordable versions for congregations. And small congregations or sometimes congregational staff would find a smartphone app like WhatsApp, a group WhatsApp, as an effective way of communicating. The question is, would they notice that it's come through unless they set the app to alert them to certain groups' communications, or would they just look at it, once every few hours? So it would have to be clear that this is an emergency group on that kind of an app. Okay, I'm going to talk about social media briefly. I think everyone's familiar with the social media platforms that are most common: Facebook, Twitter, Instagram. Twitter is probably the most commonly used platform for emergency communication these days because it's not meant to communicate other things and people monitor it. Facebook is more complicated. And also people respond to Facebook communications with misinformation or disinformation. So for instance, NYDIS has a contract to provide vaccine equity communication to the New York City faith sector. Every time we post something about the vaccine that includes information about the importance of taking the vaccine, there's always some anti-vaxxer or some right-wing commentary on the page about the vaccines don't work and vaccines are a scam and vaccines are killing people and all of this kind of stuff. So if you use social media for communicating risk, you have to also monitor misinformation that can get posted to your social media communications. Okay, let's define formally risk communication. Communicating to the public, which in the faith-based context includes your congregation and the media, because you're going to get both pre or post incident, in a way that delivers critical information. And here's the hard part: without causing fear, and informs without provoking alarm. Now, I'm not saying that if you got a text message that said evacuate your town immediately, a dam is going to break, that it would provoke alarm. It would. But risk communication gives people something to do, if you will, and not just information. So you're told the dam is about to break, but you're told how long before that might happen and what you're supposed to do, so that your energy around that crisis isn't something that you spin your wheels on and you don't know what to do, but you actually are given a task to do, someplace to channel that alarm, if you will. Did someone have a question to ask? I thought I heard someone's voice. Okay. So all of us, when we hear emergency information, have a response to that information that is cognitive. So we start thinking about it, and we also have an emotional reaction to that information. So we have a fight, flight, or fear response to critical information. Fight, flight, or excuse me, fight response doesn't necessarily mean put up your dukes, right? This isn't a cartoon. Fight means that you are thinking through the risk and you're working at mitigating the risk. That could mean fight, right? Like within an active shooter situation. But it could mean simply thinking through your response, deciding in a systematically laid out way how you're going to respond. Flight is a little bit of the same, but it's more instinctive. Should I run? But sometimes it's should I run to or from the incident. So one of the biggest risks of active shooter events in a house of worship, particularly if there is a school or youth program attached to it, is that parents will hear about the shooting and they will come to the scene and try to get into the building to get to their children, putting them and first responders at risk. It's an instinct that parents have to protect their children, but it's not a good instinct when it comes to an active shooter situation. It actually makes things worse. It doesn't make things better. It's not safe, it's dangerous. So that fight response, that flight response also are coupled with the freeze response. And good risk communication hopefully prevents the freeze. The freeze is somebody who is so disarmed by the emergency communication that they don't know what to do. They freeze. They're not necessarily even thinking effectively. They can't unfreeze themselves. They need someone else to unfreeze them. And today we can add a fourth very odd dynamic, which is this instinct, particularly that young people have, to whip out their camera and take pictures. So it's flight, fight, freeze, or selfie kind of thing, where people will take out their camera and start videotaping the school shooting rather than duck and cover, rather than fight. It's a dangerous habit that social media instinctive people have to document something without really thinking about whether or not it's safe to do that. Now, is filming the scene of a crime helpful to law enforcement? Yes, sometimes it is, but that's not really our job. Our job is to keep ourselves safe. And for those of us that are religious leaders in decision-making roles, it's our job to keep our congregations safe. So when we communicate to our public, the staff, so forth, what we're trying to do is share critical information without causing fear that informs people with facts so that they can navigate the situation, so that they can prevent harm to themselves or harm to others. The media is a different ballgame. The media can be an effective partner in communication, but the media pushes for information that is not necessarily our responsibility to give, nor should we give it. When someone sticks a camera in our face, our first instinct is, I have to speak to the press because it's going to be cool to be on TV. You're the wrong person to be communicating with the press. That's not why we communicate with the press. We communicate with the press because we're a religious leader in a position of authority that's sharing information that the public needs to know. The media is not just sharing information that the public needs to know. The media is sharing sensational information that gets people to click on their website and watch their channel. So can the media be effective communication partners? Yes, but the media also has an ulterior motive to communication that isn't just public safety and isn't just sharing accurate information. It's selling the story. And we don't want to become part of the story. That is irresponsible, incredibly egocentric and self-serving, self-promoting. That's not the role of a public communication officer, the spokesperson for a religious organization in an emergency to get a media op. Okay. Let's talk about the type of crises that we face and that we need to communicate around. Disruptive events. There was a tornado that hit this house of worship. That's a disaster, but it's a disruptive event. If this happened on Saturday at 4 o'clock, and there's going to be a wedding on Saturday at 7 o'clock, you have some emergency communication to do. You have to move that wedding or cancel that wedding, and do it in a pastoral way, in a kind way to the family that was going to have the wedding. But you also have to communicate about the loss in a compassionate way to the congregation who's going to experience a different kind of loss rather than a loss of a wedding venue, the loss of a sacred building, of something deeply meaningful to them, their spiritual home. And perhaps it's a loss to the 100 homeless people that are supposed to come Monday morning and get their meal. So you have different constituencies to communicate to, with different information and with a different emotional reaction potentially. Local emergency. So sometimes you're not communicating about something affecting your house of worship, but you're affecting your congregation as members of the community, your clients as members of community, your neighbors as members of the community. One of the findings of a study done in New Orleans after Hurricane Katrina was that the wrong people communicated the evacuation message of the city, and it wasn't listened to. And it was found that if pastors in the city had been asked to communicate that their members should evacuate, far more people would have evacuated and less people would have died. And that was because of pre-existing sentiment of racism in city government and a lack of trust in city government by Black communities. And so if city government had used Black leaders, including Black pastors, more Black New Orleans residents would have evacuated and less Black residents would have died. The overwhelming majority of deaths in New Orleans were Black residents after Hurricane Katrina or due to Hurricane Katrina. So who the messenger is matters, not just what the message is, because sometimes the government hasn't proven itself to be a trustworthy messenger in the past, but it doesn't mean they're wrong. It just means they're not trusted. So the government having the trust of community leaders, having the trust of pastors and religious leaders, amplifies their messaging when it is accurate and worth listening to through trusted partners. During disasters or after disasters, there's a lot of information to share. Some of it's functional information, like where do you register for help? And some of it is emotional and spiritual care information out of concern. People are traumatized, people are fearful, people need pastoral care, people need mental health interventions. So that information is also different. Now, not surprisingly, particularly a few of you have mentioned that you do chaplaincy work. Mental health is not always something people think about wanting or needing, mental health care. But if they speak to a chaplain and a chaplain sees signs and symptoms of psychological trauma, and the chaplain refers them to mental health care, they're more likely to accept mental health care. The challenge, of course, is chaplains who substitute their judgment for a mental health professional and think that they can take care of a person experiencing signs or symptoms of mental health distress themselves, which is really a form of malpractice and incredibly irresponsible. So knowing the signs and symptoms of distress in individuals and how they're reacting is a diagnostic tool, if you will, for faith leaders and emotional and spiritual caregivers. But in order to be trusted by government and be trusted by the people that we see distress in, how we communicate their distress, how we communicate their self-assessment of distress determines our credibility as well. And then catastrophic events. The war in the Ukraine is a catastrophic event. The global community is watching. It's deeply disturbing to everybody who's seeing it. That being said, there are families here of loved ones that are trapped in the Ukraine. Their distress is different. There are also people that want to respond to that catastrophic event by collecting things, money, stuff to send. So sometimes we're communicating not about a trauma in our community, but a trauma in another community, and we're helping people navigate what they can do about it. And sometimes we give bad advice. One of the very reckless things that happens after emergencies is people collect stuff to give away. The recent fire in the Bronx, the Twin Parks fire, was a perfect example. Just over 100 households in the building, and volunteers, volunteer groups, individual people collected so much stuff that most of it had to be thrown away. Also, a lot of the stuff ended up at Monroe College in the Bronx, which got bed bugs into their school building, which then had to be decontaminated at great expense. So when someone lives through a trauma and people want to help, we have to communicate how to help in a way that doesn't cause more problems. Just because we want to help doesn't mean we know what we're doing. Just because we want to help doesn't mean our idea is a good idea. And just because we want to help doesn't cast a burden on someone else. Which is why working in collaboration with a interagency response is always better than hot dogging it on our own, which comes back always to communication. Who we communicate with, how we communicate, what partners we communicate with. So the purpose of crisis and emergency risk communication is to prevent further injury and death, prevent loss and damage of property, to restore and maintain calm, and to engender confidence in the operational response. The purpose of communication for faith leaders is similar, but a little bit different. To restore and maintain calm, to direct constituents, which could be staff, could be congregation members, could be clients, sometimes on how they can help, but also sometimes on how they can stay out of harm's way, and to mitigate delays in recovery efforts. That means prevent, right? To prevent delays in recovery efforts and to speed up the recovery process. Now, I started off my career as a professional chaplain and an EMS chaplain. So my job was different as a college chaplain than it was as an EMS chaplain. When I had to communicate with families about the loss of a loved one as an EMS chaplain, I was doing that on behalf of an emergency management agency that has different responsibilities than I had when I was a campus chaplain to students and staff at the university, because in that context, I was one of their pastors, one of their chaplains. But in the context of emergency management, I was really a chaplain to the emergency management staff, not necessarily to patients. Patients had their own religious leaders that I needed to connect them to. So we also have to pay attention to what our roles are when we are the faith leader. Sometimes we're communicating as an employer. Sometimes we're communicating as a pastor. And sometimes we're communicating as a community leader. So we do wear different hats when we communicate as a faith leader. All congregations and all religious nonprofits should have a risk communication framework that lays out how your organization is going to communicate. That framework or that plan is developed by and for decision makers, because this isn't a framework for how individual staff communicate or individual congregation members communicate. It's for how decision makers, for leaders, communicate with different constituencies that they're responsible for. And we designate that communication preferably in advance. So the chief communication officer, for instance, might actually be a communications person on your staff, or it might be the senior religious leader, or it might be the director of security. It depends on the type of event. You should define the roles and responsibilities of staff during a crisis. And for many of the staff, it's listen to what is being communicated and execute the commands you're given. You're not a decision maker and you're not a risk communicator. You're a follower. For others, it's agreements of information release, right? Who is going to release information in what context? Contact information for those different constituencies. So whatever platforms you use, you have to know how to use them, who can use them. And I want to always say that whatever your plan is, you need to have backup and backup for the backup. So if I'm the chief communication officer for NYDIS as the CEO, and my associate director is my backup, who's my associate director's backup if I'm out of town and she's under quarantine? And do those people know who they are and know how to do this communication? Do these people who communicate also have access to the technology? So can they log on to WhatsApp, our website? Can they log into our House of Worship alert system platform? And can they communicate on it too? Or do they just know what the platform is? Can they send emails? Do they know where the distribution lists are? And do they have the technology to do it remotely? So if they have a desktop in their office, but you need a computer to send risk communication, and you don't give that staff a laptop to communicate from home, are you really expecting someone to get in a car during an emergency, go to the office and use the office desktop to communicate? That sounds incredibly unwise and potentially dangerous or fatal. And even if they have a laptop at home, do they also have a smartphone that can do the same thing? Because again, you have to have a plan, you have to have backup for the plan, and you have to have backup for the backup. What do cell phones need? Electricity. So does the person who has the cell phone at home have the ability to keep it charged even when there's no power? That's backup. If there's no power and the battery backup is dead, do they have a car charger? Do they have a car? So thinking through the redundancy essential in this plan for risk communication is a little bit more complicated than do you know where the email list is? And that's why a plan lays this out in a way that people can understand it in a simple way, and that everybody can understand where they stand in that framework. Sometimes the priority of how information gets out builds or distracts us from trust. So thinking through communication as a pyramid, who needs to know things first Who needs to know things second? Who needs to know things third? Now, in an emergency where it's life-threatening, everybody needs to know everything at the same time, right? If there's an active shooter in my office, I don't have time to call Katerina, who's quarantining at home, and say, hey, there's an active shooter in the office. Now I'm going to tell all the staff in the office, right? That's not a good set of priorities for communication. That being said, if there's a death in the congregation, I don't want to communicate that death to the congregation until I've first communicated it to those people who are in senior leadership positions. Does the family know the person has died? And does the family know I'm going to communicate their death to the congregation? So the order, the sequence, if you will, of communication matters, both in a functional way as well as a pastoral way. CERC, a emergency communication plan, this is a little bit of an advertisement for Lucy and her programs, is an essential component of a broader emergency plan for a congregation that's called a COOP plan. COOP is an acronym for Continuity of Operations Plan. There's no such thing as continuity of operations without the plan. So don't say continuity of operations, always say continuity of operations plan. The plan includes how you communicate in an emergency. That's like calling it crisis and emergency risk and not having the word communication. Your goal is to have a plan that includes how you communicate. The purpose is to strengthen your ability to protect and serve people, obviously, but your COOP document includes an emergency action plan, a CERC framework, how you continue social services, and how you continue your religious life, and to share information excuse me, that's going to be shared with the public. If you're late to the game communicating risk, people won't think of you as a good risk communicator. CNN always gets information out about emergencies in New York City before Notify NYC. Does that make Notify NYC less helpful? Yes, it does. It creates anxiety in the community because you're getting information from a news outlet before you're getting specific information from local government. The problem is the news doesn't vet their information as much as government does. So chances are the government risk communication is more accurate, but people will get their information frequently first from the news and not from government. Before, during, and immediately after a crisis event, many communities will seek guidance and answers from faith leaders first. There was a study done after 9/11 that said, in essence, about 65% of Americans trust risk communication from their faith leader more than any other source. So they trust it more than information from the police, the fire department, the mayor, the governor, the president, because the perception is that person is trustworthy and genuinely interested in their individual well-being, and they have a personal relationship with the person. So if you know the mayor, you're more likely to listen to the mayor. If you trust the mayor and have reason to trust the mayor, you're more likely to listen to the mayor. But in general, Americans listen to people they trust, not people they hear the information from first. They look for confirmation on the information and look for accuracy from people they trust. Who do students turn to when they don't trust something? Their classroom teacher. Who do employees turn to? The supervisor that they trust the most, not necessarily their boss. So trust is about relationship, and trust is not about a position of authority. Timely information from a trusted source improves communities' abilities to respond and recover from potentially devastating emergencies. The example of the New Orleans evacuation is a sad one, but it makes sense. If local government has a history of racist policies, of racial inequities, and not addressing the root causes of those social ills, communities of color, immigrant communities, vulnerable communities are less likely to trust government officials when they say time to evacuate. The other thing that fatigues people is being told over and over again to do something that has frequently proved out to be wrong. So one of the biggest fears about issuing evacuation orders is that people will remember the last evacuation order or the one before that, and they will minimize the risk in their own internal calculus. So, well, you know, we had a near miss hurricane last year and I evacuated and nothing happened. So yeah, I'm not going to evacuate this time. I don't, these guys are all full of it. You can't believe anything they say. The problem is last time it was a Category 1 hurricane and it was itinerant, it was switching directions. This time it's a Category 5 hurricane and there's little doubt of the direction it's heading in. People often don't make those connections. So sharing that ultimate level of accuracy and communicating it from a trusted individual, specifically a faith leader, is more likely to result in that information being listened to. Okay, we're going to take a brief break. Let's talk about this notion, excuse me, of before, during, and immediately after a crisis, seeking guidance. So people seek guidance for two different reasons. One, because they assess risk to themselves or others. And the other is because they don't know what to do with the information. So our communication needs to both be functional and purposeful, because we don't want people stewing in the information without knowing what action to take. Effective communication mitigates that fear, and as we talked about earlier, it is a tool for addressing this fight, flight, or freeze response. We want people to know that they don't need to be afraid of things unnecessarily, but they need to act responsibly. I'll give you the example of the pandemic. People wore face masks for most of the past 2 years, including when they were driving in their cars by themselves and walking down the street outside with nobody around. Now, you don't need to wear a face mask when you're driving in a car by yourself, and you don't need to wear a face mask when you're outside when you're not around other people. You can't get COVID that way. But people have functional misunderstandings of the science of what masks are for also. Masks don't really prevent you from getting COVID. Masks primarily prevent you from giving someone COVID, right? Because masks are not sealed, but they're a way of trapping someone's breath and the virus on their breath. So we wear masks as a form of protecting others more than we necessarily wear them as a way of protecting ourselves. But it got to a point where people were wearing them all the time, even when they weren't around others, because there's this notion that there might be something just kind of floating around in the air, even though that's not really the way transmission works. So people adapt to risk in ways that make them feel comfortable, but aren't necessarily fully accurate. That's why when we communicate risk, we want to make sure that we're purposeful in why we are communicating that risk, giving people accurate information. But at the end of the day, we do have to recognize that some people will always substitute their own judgment or their own comfort. And we need to be prepared for how we're going to respond to that too. Timely information also establishes trust, so I always want us to have timeliness on our minds. Okay. I feel like I went backwards here for a minute. Okay, let's talk about the components of risk communication. The 5 components of a communication plan are: develop and execute a framework, so a plan specific to risk communication. That plan needs to take into consideration the timeliness of the plan. So I really can't have a risk communication plan for NYDIS that says, I'm going to get information. In order for me to have the authority to share that information, I have to get approval from my assistant director, approval from the chairman of the board of directors, and it has to be read once by the health department before we can send it out. That's bureaucracy. That is not timely source sharing of accurate information. If leadership doesn't trust leaders to vet and share information, there's a serious power and control problem within your organization. But when you appoint someone to be the public information officer, the PIO, the person who shares risk communication, they have to have the trust and full authority to make decisions in the spur of the moment and communicate in a timely manner. A bureaucracy of approvals is all about power and control and not about communicating risk. Express empathy. No matter what crisis has happened, people are being affected by that crisis. And we always have to be clear, whoever is affected the most, or everyone that's been affected, is somebody that we care about and we care about their well-being. If I'm communicating to my staff about a COVID infection on our staff, my communication can't be, you know, this person on the staff put everybody else at risk, and now we're all at have to quarantine again and get tested. This is terrible. That doesn't express any empathy for the person who's infected or the stress level of the staff who now are going to be thinking through, was I around that person? Since I've been around that person, have I communicated with somebody who's vulnerable, like my grandmother I live with, or a family member who's undergoing chemotherapy? That's just sharing information. It sounds a little blamey, and it might be accurate, but it doesn't show any empathy. It doesn't set the example of when we're communicating about tragedy. Our concern as communities of faith is everybody affected, and whether or not we have care or concern for them as a fellow human being. Show competence and expertise. Somebody on the staff got infected. Holy crap, we should all be really scared, right? That's not even true. If somebody got infected on my staff and 90% of the staff haven't been around that person for a week, that doesn't show any competence in my understanding of how COVID works. It's not reassuring, and it doesn't give somebody something to do. So in communicating, somebody on the staff exposed other people on the staff. We want to say, as you all know, because we never want to assume people don't know, but when you say as we all know, it assumes they know, and if they don't, it gives them a little boost that we have confidence they might have actually known it, right? As we all know, if we haven't been around that person for several days, there's no risk to us. So for those staff that have been around this individual in the last 72 hours, I'm going to ask you to quarantine for 3 days and then get tested, and then you can return to the office. That shows I understand how the virus works. I understand what the rules around exposure and quarantine and testing out are. We want to make sure that anybody who communicates risk can demonstrate that level of expertise. I can also add, if yet any of you are feeling anxious or upset about this and you want to talk about it, please reach out to your supervisor or reach out to me. And remain honest and open. I don't know, we don't know where this person got the virus. They haven't been tested yet. They haven't gotten their test results back. We will communicate with you once we have that information. So that honesty, that openness also builds credibility and trust. So here's how we go about creating a communication plan. One, you got to create a CERC leadership team, right? Made up of clergy or credentialed religious leaders and lay leaders, especially those who manage congregation communications. Anticipate the kinds of information that you will need to impart to people. You're going to communicate in a congregation, you're going to communicate deaths in the congregation. You could potentially communicate about power outages or damage to the building or the closing of a youth program or the closing of a food pantry prematurely. You know what you do, and you know which of those things are likely to experience disruptions. You know what hazards are likely to affect New York and what hazards you may need to pre-plan around communicating about, right? Hurricanes are a good example. Urban flooding, like we saw during the recent post-tropical storm Ida flooding in New York City, which flooded about 80,000 apartments. You know that urban flooding is a risk. You know that fires are a major risk. You know, if you're part of a vulnerable community, that hate crimes are a likely risk. Organize through that committee how you communicate to each target audience. And you can pre-draft your messages based on each risk. Doesn't mean they might not need to be tweaked depending on what the event ends up being, but your plan is going to say who is responsible for what. So who will draft risk communication messages? Who will approve it? Not how many people will approve it, but who right? You keep this as a tight group here. This is a 1 or 2 people thing. It's not a committee thing. You can't committee risk communication. Doesn't work. What mode of communication will be utilized? Email, SMS, which means text messaging, social media, robocalls, whatever. Please don't use phone chains. Phone chains are ineffective, and phone chains without a script, a written script, usually result in miscommunication within 2 calls. I don't know how many of you have played the game telephone in the past, but miscommunication is very common in human-to-human message transmission in things like phone trees. Who is responsible for posting and sending messages? Who is in charge of answering community members' concerns? Who maintains contact databases? You can add other things here. Who is in charge of talking to the press? Who's in charge of talking to the staff? Who's in charge of talking to the congregation? Clients, tenants, the list goes on. Develop the plan together as a committee. Simple wording. You don't want anything to be communicated. Just so we're clear, the average American communicates at a 6th grade level. I know that might be disturbing information, but the average adult American communicates at a 6th grade level. That means 6th grade vocabulary and 6th grade comprehension. That has to do with many different factors. So, in general, you're communicating in a way that a 6th grader could understand your message. Don't use fancy words. Don't use medical terminology that you don't define, but communicate plainly, simply, with easy words to understand, and not in a condescending way that makes it sound like you're writing a message for someone who's dumb. A 6th grader isn't dumb. I don't know how often the last time any of us were around a 6th grader. 6th graders are fairly savvy in this day and age. They know when they're being condescended to. So you want to be first. You want to be right. And sometimes that means you can communicate less information than you've heard, because not all of that information is confirmed. But be first, be right, be credible, express empathy, and always promote action and show respect. When you talk about COVID, the last thing you want to do, and this was always the problem during the last 2 years of the pandemic, when you say the federal spokesperson for the pandemic is an idiot and a charlatan, like people have been talking about Dr. Fauci, that means that many people now don't think he's credible or that he's right. So it actually undermines public health. It actually puts people at risk. There's a lot of people in the United States that have the wrong information on vaccine science and have made the wrong decision into not getting vaccinated by a vaccine that is empirically safe. So be first, be right, be credible, express empathy, promote action, and show respect. I think one of the most important things in this series of 5 is promoting action. People need something to do when they're being told about something that's a little intimidating or scary. And it needs to be constructive, and it needs to be age appropriate. And in our case, it needs to be faith community appropriate. So if I communicate that people need to do something, I want to make sure that it's something that they actually believe that if they do it is helpful. And if I don't really yet have anything for them actionable to do related to the risk because I need more information, one of the things that I can promote that is action is to say, I'm going to communicate updates every 15 minutes. It does promote action. It gives them something to do. They can set their timer, or they can take comfort in the fact that I've said I'm going to communicate what happened every 15 minutes until I have an update. Even if all I have to do, all I have to share is it's been 15 minutes and there's no new information. That in and of itself is comforting, even though it might also be frustrating. But promoting action can also be an evacuation order has been issued. You need to start packing the following things. And I'm going to give another update in 30 minutes or 60 minutes. It gives people something to do during the meantime so that their mind isn't spinning about, now I have this information and I don't know what to do with it. You want to review your risk communication plan typically every 6 months, every season. So here in New York, the two most important seasons that create the most risk are winter and summer. Winter is snow, ice, freeze over, flooding. Summer is hurricanes, straight wind storms, tornadoes. So seasonally, those 2 times of the year make sense. What is always unpredictable is human-caused events. So things like terrorism, hate crimes, active shooter. Those can happen in any season. So we have to fit those in too, but they're not seasonal risks. And we have low risk for some things here in New York State, New York City, things like earthquakes. We are not in the ring of fire, which is a term for parts of the world that sit above majorly active earthquake fault lines. So the Pacific Ocean, the Pacific plate has a ring of fire around it. So slipping tectonic plates around the Pacific that create high risk for catastrophic earthquakes. We don't have that here in New York. There are faults in New York. There's one that runs under 125th Street, actually. But it's not an active fault, and it tends not to have very strong earthquakes. And most of the earthquakes that you would feel in this part of the country are a tremble, and they probably sound more like a subway train going under the building than major shaking. So let's talk about what it would mean to review a plan. Review a plan doesn't mean take it off the shelf and read it. It means take it off the shelf, read it, update it, and preferably hot wash, which is a fancy emergency management term for debrief, a recent incident where things went right or things went wrong, or maybe both. Because we learn more from incidents that have happened and how we communicated about them that help us improve doing it better in the future, right? Improve on doing it better in the future. Oops, why are we, my slide advancer is not working. Okay. Whenever possible, you want to have a tabletop exercise of your plan. A tabletop exercise is where you sit around a table and talk through a threat and your response and the steps you'd take in relationship to that response. It is far less complicated and time consuming than actually acting out a scenario, which is generally called a drill or an exercise, sometimes gameplay. So you can do seminars and workshops and tabletop exercises with lower levels of capability and expertise and lower levels of complexity. But as you get up into gameplay, drills, functional exercises, and full-scale exercises, these kinds of things take a sophisticated, experienced facilitator and a lot of advanced planning. But I want to give you some examples to make it easier, right? I worked in parish ministry for, 8 years before I went to seminary. In that period of time, I participated in one sanctuary fire drill, meaning a fire drill in the middle of worship to evacuate the sanctuary, which includes everybody, right? The congregation, the choir, the altar party, the whole shebang. A lot went wrong during that evacuation, during that drill. And yet, it happened about 2 years before I left that job, and they never did another one, even though it did not go well. That does not strike me as good planning. It doesn't strike me as concern for other people as well. Yes, getting your ordained religious leader to disrupt the liturgy and evacuate the sanctuary and get them back in, all of which takes at least 20 minutes, is something a lot of clergy probably don't want to do. They also don't want to have funerals for multiple people. So when you think about how many people you have to get, in general, you want a fire drill to take less than 3 minutes to get everybody out in less than 3 minutes. If you think about the size of your space, where your emergency exits are, and what it would take to get people out, believe me, even if you think it's going to go well, it's never going to go as well as you think it's going to, and people do need to practice. So I do believe in practicing. I do believe in physically acting things out whenever possible, but that tabletop exercise has a lot to teach us as well. So here's your checklist, a suggested checklist. This is a very basic plan, by the way, right? This is not a super sophisticated plan. Do you have signed off approval on this plan? Like you got buy-in from leadership? That means your senior religious leaders, your senior lay leadership, chairs of boards, and all of that sort of thing. Are the roles and responsibilities in the staff defined? Do you have agreements on internal information verification and clearance procedures, including third-party validators if that's necessary? And I would add to that, does the primary risk communications person understand that they have full authority to communicate certain things without ever getting anyone else's approval? Anything that's life-threatening and urgent in particular.
Peter, can you give examples of those, the clearance procedures and third-party validators?
Sure. Let's just say there's been an outbreak of E. coli or some other dysentery type of bacteria at a parish event, right? So let's say, just say a lot of people are getting sick. What's the process for, right? That's not life-threatening, but you need to let people know. What's the process for verifying that it happened at your facility? And who needs to decide whether or not or how that information is going to be shared? And is there anybody else that needs to sign off on sharing that information? A lawyer, a board chair? So there has to be an internal verification process. There has to be a clearance process. But there's also often somebody who gets to say, "Nah, man, you can't say that. That creates legal liability for us if you say that." Now, I'm not talking about the city says evacuate and you're passing on the city's evacuation order. That's easy, right? All you have to do is pass on the information and say, the city has issued an evacuation order. We encourage you to evacuate. You don't need a lot of approval for that. But when it comes to internal mechanisms for approval, where risk or misunderstanding could take place, getting that clearance is important. Okay, is there a religious body, like a judicatory body or religious media that should be included in your communications? And what are the procedures to coordinate with public health or emergency management or VOAD or other networks that support houses of worship and faith-based organizations during emergencies? Okay. In order for your CERC plan to be effective, it must be developed in advance. Just never forget that. You can't develop a plan on the fly. It doesn't work. Now, we'd like you to take your template, again, remembering these principles, right? Be first, be right, be credible, express empathy, promote action, and show respect. And keep in mind your audience. What languages do they speak? Their education level. And again, we're speaking to a 6th grade audience here. What are the visual and hearing capabilities that exist in your community? And what are beliefs and cultural practices? All of these things can enhance your ability to communicate, or they can retard your ability to communicate. They can make it more complicated. Just because you can't communicate quickly in Spanish doesn't mean you shouldn't communicate quickly in English and say you're going to have a Spanish translation out in the next 10 minutes. That's cultural accommodation. It's not prioritization, right? The goal is messaging that is meaningful and correct to the community it aims to inform. It's pretty simple. Okay, this is a scenario I want you to write a plan about on your worksheet. So get the wheels of progress moving. It doesn't really matter what the date is, but on November 12th, you can say on, what's today, March 9th, March 10th, a food handler in a local supermarket chain in your neighborhood was diagnosed with hepatitis A. Hepatitis A is spread through close personal contact or through contaminated food or water. Persons who have been exposed to hepatitis A who have not been previously vaccinated should receive a dose of the hepatitis A vaccine. The health department will be providing the vaccine to people who purchased fresh cut fruit from the supermarket between the dates of November 3rd and 12th. You can count the days, it doesn't really matter, right? To distribute the vaccine, New York City will set up 5 points of dispensing, otherwise known as pods. When pods are ready to open to the public, the mayor will make an announcement. Please pass this information to your constituency and stand by for pod locations. This is a great message, right? It has all the details to give us context. It tells us when we're going to get information next. The only thing it doesn't really do is tell us that, you know, hepatitis doesn't present immediate life-threatening risk, right? You can't get exposed to hepatitis A and be dead by dinner. You're going to get sick first. So it's not that kind of urgency. So this is the kind of script that we would send, NYDIS would send. This is a New York City, House of Worship alert, basically. Please check your email for important information regarding a hepatitis A outbreak in your borough. This shows them that there's important information, but it sets the tone that it's not immediately life-threatening, and you need to, read the information that was sent. This is a text alert versus a robocall. A food handler at a supermarket in your neighborhood has been diagnosed with hepatitis A. New York City Department of Health and Mental Hygiene is providing vaccines to those exposed to the virus. Click here for more information. So again, being clear, this isn't like an emergency of the moment, like you have to run, but you need more information. So take your worksheet and write a message. We're going to give you about 10 minutes to do it. Last night, there was a fire in your house of worship. It caused, the cause, is unknown. As I think you all know, it takes usually a couple weeks to figure out the cause of a fire. FDNY is currently investigating. Office space and records were untouched, but there's some damage to religious objects in the worship space. The worship space was to be used in 2 days, right? 48 hours for a routine service, and in 7 hours for a funeral. Leadership is seeking an alternate location for the funeral, and we'll announce it soon. It is not safe to be near the structure at this time due to air quality. Right? Notice I didn't say like structural damage. So compose an email for your congregation members and community members that gives these facts in an update, and use this form. So please take a few minutes. You can type it on over the form on your computer or write it out by hand. Let's see, it is 11:02. We will come back at 11:10. So we'll give you 8 minutes to write the message. And I want some of you to be prepared to share the message you wrote. Okay, 10 minutes. How did it go? Barbara looks very confident in her message.
I am absolutely delighted that our church has already made arrangements with two other churches that are within several blocks of our church. And it's reciprocal that if there's ever an emergency damage, that if the other congregations are not, like the fire, that we can go there, join their worship. We also have a very active Zoom. We've had our pastor, when we first started Zooming, Zoom from the closet in his bedroom, because that was the least noisy. So we already have the alternative methods of having a service, and we so that just feels really, really good. And they're three different denominations. So that's been a very nice collective effort. This is more notes than it is a properly written piece.
Okay.
But last night we call ourselves CCC, Community Christian Church, which is duly aligned Disciples of Christ and United Church of Christ. Last night at CCC, there was a fire. The Chilai, which is the town that we're in, a suburban town, Chilai Fire Department is investigating. Our records in the office were not damaged, but there was some damage in the sanctuary, and we have had sanctuary damage before. So Sunday worship will be at whichever church we already have spoken to by the time we release this, which is just a matter of a quick phone call to the pastor of the other church. And that's a personal cell phone that each one of the pastors has shared, and the property committee has shared with one another in case of an emergency. Let's see. For your safety, due to air quality issues, we are closing the building. If you have questions and concerns, please, Patty, one of the people who does church-wide distribution on a regular basis every week after service, identifying joys and concerns and all of those things. Patty or Sandy will send out an email, and we have maybe a cluster of elderly who are shut-ins but do not have computer. We have one person who calls and speaks to each one of those people. That would automatically take place. We're committed to continuing all the activities and services provided by CCC. And we ask you to please stay away from the building until the fire department and the air quality issues are resolved. And again, look for an update from Patty or Sandy, but no later than tomorrow morning. So that's essentially the component parts that will be addressed.
Great, thank you. Would anyone else like to share theirs? Don't be shy. No one else? All right, I'm not going to put anybody on the spot, but I appreciate your sharing, Barbara, and I hope all of you will look at this message template and become comfortable doing it in an automatic way, right? Because there's not always time to find this kind of a worksheet in an emergency. But anyway, you get my point. So did you have any difficulties writing the message that you wanted to ask any questions about?
Hi, this is Apostle Ramos.
Hi.
Hi, Peter. So basically, I did, because it's hard to wrap around my brain that everyone mostly, as you so eloquently put it, is either learning or hearing from this 6th grade area. And so that kind of shook me a little bit. So trying just to be as honest and open and just regular, and not to say that I'm not, but it just kind of made me hesitate a little bit, so that I was really clear that everybody was understanding just the basics and what was really needed. And so I did all that, and I appreciate the worksheet, because in the boxes from the one that I'm looking at, it says like avoid certain things that I found myself doing in areas, and it just really needs to be, as you expressed, you know, from the slides, that I wrote it down also, you know, first, right, credible with the work that we do here, the pastoral work, as well as being a community pastor and violence interrupters. We are also credible messengers. We're credible witnesses. So just trying to make sure all of that is in there and understandable, and just, you know, crisp and clear, kind of threw me for a bit of a loop. Not many questions, but it helped me to understand it doesn't have to be so extravagant. It just really needs to be a good, meaningful, correct message. So that was my take.
Thank you. Yeah, I think it's important for us to remember that, you know, more than half of New Yorkers speak, New York City New Yorkers speak a language other than English at home. That doesn't mean that some generations don't speak English or only English, and some speak a combination and some speak none. But we're, you know, that 6th grade level is about making the English simple enough for someone who doesn't speak English well as somebody who isn't really kind of educated beyond a 6th grade vocabulary. And that this has nothing to do with intelligence, right? This has to do with functional language. People are intimidated by big words, and they don't necessarily understand medical language sometimes at all. And so we're trying to just make the vocabulary that we use accessible to people who speak English, who don't speak English, and sometimes even are relying on their kids to read communications to them. So we don't ever want anybody to feel lesser than or not intelligent, because functional intelligence does not mean that someone is not a smart person. It just means that they got a different kind of education or speak a different language. I don't speak Spanish well, but I'm an educated person, right? So you know, you can make sure that people feel confident that you're not talking down to them, but you're just trying to communicate with them. So we talked about the fact that it wasn't easy writing that message. Did anybody listening to Barbara or listening to how the information was laid out, those sort of 6 points that we talked about, right? Where are we? These 6 points. Oh, be first, be right, be credible, express empathy, promote action, show respect. So, whoop, did anybody come up with a way that they think improved the way they were already doing things?
Okay, so here I go again.
For it.
I did come up with a way, because yesterday, I'm not sure if anyone knows, in the Bronx area, there was a vigil for a young lady, excuse me, I'm a little out of breath, for a young lady and her daughter that were murdered. And when we have to go to these shooting responses or vigils, what you're expressing here definitely needs to happen, especially in the same frame of whatever CERT message that it applies to, whether it's for the safety of the church or whether it's for public safety or so on and so forth. So I did find it to be a lot easier to run through those, for lack of a better term, models, so to speak, to really keep me focused in creating this message. So it's easier for me to touch on 1 and 2 and 3 and 4, just so that I could get through the message and really still be clear as what was being delivered, if you know what I mean.
Mm-hmm.
So it helped me to really focus. I guess that's what I'm really trying to say. Because a lot of times when you have to do this, like Barbara explained, so very simple, but very clear of what's happening and what needs to go on with the church, when you have to do these things, it can become a whole different picture. And I think for us, where a lot of the activity is happening, or a lot of the things that are going on in our area, in our region, it'll take you totally somewhere else. It can become very political. It can become very, they're angry people. There's a lot of emotions and things that are going on. So to stay focused on these models or these points, it really helped me to get through the CERT message.
Thank you. Anyone else?
Peter, I think that using the 6th grade level communication also, whether English is one's first language or not, and we have multiple first language from a whole variety of parts of the world, but when someone who has English as a first language hears that there's an emergency or a crisis or something has gone outside of normal, we tend to shut down a little bit. So the simpler the language and the simpler the communication, that allows us to wrap our minds around what is it that has happened in while other things are going on, and we're calming ourselves down.
Thank you. That's very helpful. Okay. On this last point, I just want to say that, this is obvious, but we're going to have to say it anyway, since this is a training. Once you send the message, you can't get it back, right? So we want to make sure that when you send a message, particularly the first time you send a message, that you kind of like try it out. There's always a great opportunity to kind of introduce a new emergency messaging system by simply saying, we're going to test it, right? You don't have to feel like the first time you send a message, it's a real-time message in an emergency. Sending tests of your churches, your synagogue, your mosques, emergency messaging system, whatever it is, can always just start with, this is a test of our emergency alert system. Please add it to your safe senders list, or whatever people do to make sure it doesn't get caught in a spam filter, because these messages definitely do get caught in spam filters sometimes, or people get, like me, I don't answer the phone if I don't recognize the number. I let it go to voicemail. So you want people to know the number. You want people to recognize the email address. It's always great to have an email address that says emergency in it, right? Rather than just say, this is Lucy Cummings at NYDIS.org. This is emergency email at NYDIS.org, right? That way it's never about the person, it's always about the content. But when you do send that first message, you do want that message to get heard. So sometimes that first message is good enough to just say, this incident happened and I'm going to have details for you in 15 minutes, right? Rather than trying to compose a long email with a lot of information and do it really well, because you're going to be feeling the urgency of the communication yourself. But if you know you're going to have to send one out, you should give yourself a pass, be kind to your own mental health, and just say, you know, there's been a death in the congregation, or so-and-so died, and we're going to have more details for you in 15 minutes. Please don't share this information until I get the facts with you. That way they know what happened. They're told not to gossip, but they're told not to gossip kindly, with a non-judgmental, please don't gossip. And they're going to be told in a relatively short period of time, they're going to get accurate information. And particularly when you're sharing information about people, you'll notice the press does this. And it is a good practice of saying, we can't give further details until the family has been informed. That shows empathy. It also reminds people it would be destructive for them to jump into the gossip chain because the family doesn't even know yet. So please, like, keep it to yourself, kind of thing. The other thing I want to make sure that we pay attention to when composing emergency communication messages, and we saw a very bad example of this past week. Sometimes people like to show off that they're in the know. And Marco Rubio did it this week on a Zoom call with the president of the Ukraine, where he posted on Twitter that he was in a Zoom call with the president of the Ukraine, and in that tweet revealed the location of the president of the Ukraine, who was in hiding so the Russians couldn't target him in a bombing. So in his, I will try not to apply any nefarious intent. In his exuberance to prove that he was in a Zoom call, he actually put the person in harm's way. So we want to make sure that we never put someone in harm's way innocently or intentionally. And harm is not just about physical harm, it's about emotional harm and the distress that information causes others. So again, you can't take the message back, but you can paste the message. You can get it out yourself with minimal information just to alert people, and give yourself the time to compose a really strong, comprehensive message. You want to make a comment, Barbara?
Yes, one of the things that I've done in a variety of settings is to write potential messages. One of the things I did was when we would, one organization would receive grant money or donations of any kind, there were a series of 5 different letters already drafted. So the first time somebody donates, the second time, the third time, continuing support is those kinds of things. But our church, we're open and affirming, and somebody came by in the middle of the night and spray painted some very anti-LGBT on our building. That was when we started realizing that we needed to have letters and things prepared, so we didn't have to take the time to create something, but we would take the time to tailor something to the situation. So I don't know if that's the expectation, to have those kinds of tools already in the crisis plan. So
Yeah,
that
I think you want to have some templates ready to go. Recognizing none of them are ever going to be perfect. They're always going to need a little tweak.
right.
But yeah, I do think having some templates ready to go is strategically smart. So I just want to remind you that we have an app on our website. You can also find it on the Apple Store and things like that, called Religions and Disasters. It's free. It is a primer of different faith traditions and their belief systems, everything from death rituals to burial traditions, the perspective on mental health, mass care like sheltering, feeding. And there is also an archive of all of our tip sheets, our field manual, that is easy to access there. So, you know, sometimes part of communicating is just letting people know what communities of faith believe and, you know, what our mission is, if you will. But sometimes we also need to speak out for one another, and you know, ask people to listen, and let us articulate for ourselves what we need. So I hope that you'll look at that resource. There's a lot of stuff always on NYDIS's website. We put a lot of recovery resources up there as well. I hope that you have registered for How Alert. If you have not, you can do it on our website, on our homepage, and we'll make sure that you get in that system so that you get emergency information as it comes out. And if there are trainings that you're looking for, other trainings, we do continuity of operations planning training regularly. We do the CERC training regularly. We teach mental health first aid regularly as well. And we have a disaster chaplaincy certification course coming up in June for anyone who wants to serve as a disaster chaplain in city response settings here in New York City. I also want to add that chaplaincy is a varied profession. Professional chaplaincy requires certification. Most frequently, the National Association of Professional Chaplains has a certification called Board Certified Chaplains. These are frequently hospital setting chaplains. People throw around the term chaplaincy today often without context, and all chaplains are not the same. So there are national standards for professional chaplaincy, and there are national standards for disaster chaplaincy. And then there are lots of organizations that call themselves chaplains or have chaplains that are simply religious leaders that got some sort of a local training that isn't nationally recognized or an accredited training at the state level. So it's so important to know who is training you and what the training credential actually means, and who recognizes it. But when it comes to disaster chaplaincy, there's only one standard, and that is the National VOAD standard. And that is what FEMA, state emergency management, city emergency management follow. There are precinct chaplains, there's fire chaplains, there's hospice chaplains, there's nursing home chaplains, there's school chaplains, college chaplains, military chaplains. So a lot of variety in there, but it's not all equal. And so it's really important to know what you want to be a chaplain for, what you want to get trained in. I encourage you to explore that with Lucy, if that's something you're interested in, is disaster chaplaincy or city emergency chaplaincy here in the city. While you all are finishing your evaluation, I just want to again thank you for spending a couple hours with us and learning about something so critical to your congregations and New Yorkers in times of crisis, making sure they're getting accurate, trusted information to keep themselves and others safe, and to know how to respond to human need as it emerges in times of crisis. So thank you for being with us. Again, please complete the poll and we will get that additional information out to you in the days to come. And otherwise, I wish you very happy Thursday. Weather's getting warmer. We have a whole week of warm weather next week. We just have to get through the rain on Saturday.
Thank you for the whole presentation. Thank everybody, all of us, for sharing the experience that we've been privileged to have, and sharing that is just so incredibly important. Thank you.
Thank you.
Thanks all. I'll
Thank you,
be in
Jennifer.
touch.
Thank
Be
you,
well.
Peter. Thank you, Lucy. Thanks, everyone. Have a great
Bye,
day.
everybody.
Take care.